Do you struggle with dark spots, uneven skin tone, and stubborn body hyperpigmentation? You're not alone. Hi, my name is Dr. Jenny Liu. I'm a board-certified dermatologist, and welcome back to my YouTube channel. Today, we're going to talk about body hyperpigmentation, some of the most common causes, ways you can prevent it, and some derm-approved products that are readily available and pretty affordable that can help to fade them more quickly. So if that sounds all good to you, I would love it if you can give this video a thumbs up. Don't forget to hit that notification button and subscribe to my channel. So first of all, what causes hyperpigmentation? Hyperpigmentation occurs when your melanocytes produces more melanin. Melanin is the color that gives us our skin tone, hair color, eye color. And obviously in somebody who has a darker skin tone, they have more active melanocytes, which is why we often see hyperpigmentation being one of the biggest concerns in the individual who do have more darker skin or more melanin-rich skin compared to someone that is more fair skin, because the melanocytes have different activity and also the type of melanin is produced is a little bit different. So the good news when you have more melanin-rich skin is that you have more pigment to protect you from, say, UV radiation, but unfortunately that melanocyte can be a little more sensitive at times and can be triggered more easily and thereby produce more pigment. But regardless of the location on your body, hyperpigmentation occurs when your melanocytes create more pigment. Now, that source or the trigger of your melanocytes can be various different types. Commonly, we just kind of basket that into inflammation. Inflammation is the source of like acne, eczema, psoriasis, but could also be from sun damage. That is one of the biggest triggers for the skin on the face, right? UV damage can trigger your melanocytes to be more active and produce more pigment, can be one of the hallmarks of sun damaged skin. But in individuals of color, you may even notice hyperpigmentation on non-sun exposed areas. And that often could be very subtle subclinical inflammation that can be from even just friction. Like for example, body fold areas is a very common location where people will note hyperpigmentation because of friction, skin on skin rubbing that can occur. Shaving can be a very common source of irritation, friction that can lead to hyperpigmentation. And then sometimes just even if you're in the habit of like always like putting your elbow down, rubbing on your elbow, when there's redundant skin, sometimes the skin is thickened and that gives the appearance of hyperpigmentation. And lastly, there can actually be medical conditions associated with the appearance of hyperpigmentation. Like we talk about dark neck, especially on the posterior neck, dark underarms and thighs. That is not just a darkening of your skin, but often there is a textural change to your skin where your skin looks a little bit more thickened and velvety. And that is associated with acanthosis nigricans is what the condition is called on your skin, but associated with metabolic syndrome, obesity, and type 2 diabetes. And lastly, I just want to mention is that hyperpigmentation, especially in certain parts of the body fold areas where there's redundance of skin, like your elbow, your knuckles, your knee, as well as certain parts of your face, even your arm, posterior leg. Those could be variations of just normal because of your darker skin tone. In fact, like I mentioned earlier, when there's redundancy of skin, like you stretch out your skin and then you relax your skin, that excessive skin, when you have darker skin, when it's kind of just relaxed, can look darker. And similarly, there is something called pigmentary demarcation lines, and this has to do with your melanocytes during fetal development. They migrate a certain way, and there can be one area of your skin that looks significantly darker than the other, and it literally kind of presents as a line on your arm, on your face, on your leg that is a stark contrast. Like one area is darker, one area is lighter. And that is actually a variation of normal. And to be honest, very few treatments work really well, in the sense like they may temporarily work, but often those come back. And so just understand that when you have darker skin tone, there is often multiple reasons for hyperpigmentation, and sometimes it's just a variation of normal. So now, understanding some of the common causes, what are some things we can do? Well, if you have darker skin tone and you struggle with body hyperpigmentation, I would say the take-home message from this video is that less is more, go slow, and be patient. Body hyperpigmentation takes long time, even longer than facial skin, in the sense because the skin tone may be longer, it is also thicker, so it's just harder. And especially on the legs, when often things just are slower to improve because the nature of gravity and the blood flow to our lower legs are not as well compared to our face. And lastly, we may continue to subject our skin to the cause. For example, if one of the main causes for underarm hyperpigmentation is shaving, and you continue to shave, and that is the only effective way for you to remove underarm hair, then it's gonna be much slower, right? Than say, if you have the budget to get laser hair removal, that can be a very much easier solution. So it really just depends all on the cause and what you can do to manage. But regardless, what you don't want to do, especially if you have darker skin tone, is go overly aggressive with all these lightening products, because like I mentioned earlier, the darker your skin tone is, the more sensitive your melanocytes are to sources of inflammation, and they can get easily triggered with from inflammation. And the inflammation could be just a skin barrier damage from aggressive exfoliation, from aggressive or too many products that's targeting hyperpigmentation, and that irritation can actually add more fuel to the fire, and at the end of the day make your hyperpigmentation worse. And I can't tell you how many times I've seen this in clinic happening. And so this is where you have to just be patient and be consistent, and also at the end of the day see a dermatologist just to make sure that you are actually using the right products to treat the right conditions. But regardless, I think some of these products and tips I'm going to share with you should be beneficial for most of you struggling with hyperpigmentation on the body, regardless of the underlying cause. Number one, the tip is that you want to exfoliate regularly, but here's the caveat: you do not want to be exfoliating with a scrub or a rub or like a loofah. You want to avoid physical exfoliants because that's too harsh. What you really want to do here is go with a chemical exfoliant, namely in forms of combinations of alpha hydroxy acids, maybe even like a glycolic and lactic acid. You can even definitely throw in a beta hydroxy acid in there, but often glycolic and lactic acid are the ones that's going to be most helpful for reducing pigment production, helping with skin turnover, and over time help to brighten your skin and helping with uneven skin tone. This is also the ingredients I really love if you struggle with like keratosis pilaris and having kind of those dark spots on your arms or on your legs. Some people even call that like strawberry legs because of the KP. Over time, that will help. Now, you can find AHAs and BHA combinations in various different forms. And I would say just keep in mind that cleansers are going to be more gentle. They might not be as effective, but definitely can be used a little bit more regularly than leave-on treatments. And leave-on treatments, it really depends on the formulation. But usually, glycolic lactic acid body lotions are going to be more tolerable in the sense regular use, daily use can be fine for most people, but those like higher concentrations like 7%, 10%, toners, depending on the location, you have to use with caution. This is kind of like where I will even treat them as like retinoids, where low and slow, you start off like maybe only once or twice a week and gradually increase as tolerated. And honestly, for most people, if you are using like the ordinary toner with something higher concentration, at most probably 2 to 3 times a week is all you should be using anyway. So some of the products I really like that are gentle that I think is great for daily use is number one, Naturium, the smoother glycolic acid body wash. This is a body wash, and honestly the contact time, the formulation, it helps to gently exfoliate some superficial dead skin cells, but it's not going to be overly aggressive or irritating on your skin. It's formulated with glycolic acid, a lactic acid blend, and various different other AHAs, and has kind of this biomimetic algae. It's just really nice body wash that you can use in the shower to kind of smooth away some of the roughness, and again, removing some of that superficial dead buildup of skin cells. Another one that I find to be really nifty, especially for those really hard to reach areas and you're struggling with hyperpigmentation, like your back from like say acne, is Topical's Faded Body Mist. And this is a pretty gentle body mist that you can spray on areas that you struggle with darker spots, and it will target those hard to reach areas. And overall, the ingredients is pretty gentle, and certainly I think can be used on a more regular basis as tolerated. And again, this is where, depending on your skin, probably the best thing to do is maybe spot test an area for a few days before you use them more widely and more regularly. And ingredient wise, it's got a lot of nice brightening ingredients that are fairly gentle, including kojic acid, niacinamide, alpha-arbutin, tranexamic acid, and does have a little bit of glycolic acid, but my understanding is the concentration is fairly low and it's not going to be irritating even if you do use it on a more regular basis. But again, depending on your skin type, always test before you use more widely. Another product, again, this is one where I think it can have benefits, but you want to use with caution. Always test and probably limit the use, especially for more sensitive skin. But the Necessaire Body Peel Resurfacing Serum can be helpful. It does have higher concentration of exfoliating acids that can, if you do it like maybe once a week or a few times a month, kind of more greatly improve your skin turnover and help with exfoliating some of the dead skin and brighten your skin. But again, because of the higher actives, it could be a double-edged sword. So again, always test. But this is a really nice one if you want to splurge on something that's a little bit more elegant, that can make your skin look more soft, feel softer, and look brighter. It does contain 12% of that peel to help treat and also fade dark spots. And it does have a little more sticky nature. And so even the brands say you can even mix it with like a body lotion to help minimize that stickiness. But ingredient wise, it's got 12% blend of the AHA, BHA, and PHA. So namely 10% AHA, 1% salicylic acid, and 1% PHA to help improve and turn over your skin. It also has 1% of a healing peptide, helping with dissolving dead skin cells and improving skin renewal, and then 1% resveratrol, which could help with skin brightening. And so this could be a great option, but again, because of the nature of the high concentration, use with caution. And then lastly is Lactin Daily Moisturizing Lotion, 12% lactic acid. This is actually my personal favorite brand. I recommend for KP, and I've always struggled with keratosis pilaris my entire life. I actually still struggle with it on my lower legs, and this is one I've been using probably since high school. And lactic acid overall is pretty gentle, and unless I have like a razor burn which will temporarily stain, it is one that I actually continue to use on a daily basis as my lower leg body moisturizer when I get out of the shower. So I tolerate that just fine. It does make you more sun sensitive, as with all acids will do that, and so just be careful. But this is one definitely on my legs. I'm not putting in my body fold areas, but on my legs I tolerate that regular basis, and it keeps my keratosis under control. So that is a great option if you do struggle with like hyperpigmentation around your hair follicles because of the KP. Great one, helps to moisturize, helps to smooth out dead skin cells, make your skin look smoother and brighter with regular use. Now, if you can't tolerate the acids very well, one thing you can consider is a body retinol moisturizer. And retinol definitely is slower, but can over time with more consistent use improve that uneven skin tone. It will just take time. And I do find that most of the body retinol products I've tried over the counter, they are definitely very gentle and if anything, just very nourishing and make a great moisturizer. So it's one of those where I think they're going to be definitely less irritating than the acids. But again, if you have sensitive skin, always test. And I honestly will just use the retinol as my body moisturizer, but you can certainly kind of target it to areas of concern, or say if you struggle with anti-aging concerns, these retinol moisturizers too can be a great way to kind of, if you want to improve your necklines or your chest or even hands. And there are definitely a few on the market that are really nice. The first one is Versed, their Skin Gentle Retinol Body Lotion that is very gentle and over time slowly improves your skin texture and skin tone. And it's creamy, nourishing, but not sticky. It's pretty lightweight. Ingredient wise, it's got 0.01% encapsulated retinol. So lower concentration, but less irritating. And encapsulated retinol definitely makes it more stable and hopefully penetrate better and work more efficaciously. And then also it has 2.5% cocoa butter, 1% squalene, and vitamin E. So very lightweight yet nourishing body lotion that is a great one with retinol that can slowly improve uneven skin tone as well. Paula Choice has a retinol skin smoothing body treatment that is also a really nice one. It contains pure 0.1% retinol concentration, along with shea butter and evening primrose oil, along with some antioxidants. And so this is a great one with antioxidants, and it's got a really nice silky smooth texture that really helps to improve your skin tone and texture. It's a great one for helping with brightening your skin, but also I love it for the anti-aging benefits if you want to use that for your body too. Now, before we talk about prevention, since I just listed a bunch of products, you're probably wondering like, okay, what products can I use where and how often? And this has to go back to, again, understanding the underlying cause. But in general, body fold areas are going to be more sensitive than, say, your arms and your legs, your chest and your back. So it depends on the location, but it also depends on what you're treating. For example, if you struggle with body acne, aside from treating the hyperpigmentation, the most important thing is actually getting your acne under control. And often the treatments that you use to treat your acne, like for example, salicylic acid, adapalene, will naturally improve the hyperpigmentation too. So you have to, there are a lot of nuances. So that's the thing where it's really hard to give personal advice. But in general, what I can say is understand that your body fold is more sensitive. So what does that mean? That means with any product, you probably want to test and really introduce it to your skin only a few times a week, especially if it's got higher actives, and then build up a tolerance slowly, kind of treating like retinoids, how you would treat like tretinoin, going low and slow. And also, in general, cleansers are going to be less irritating than leave-on treatment. So even if it's a glycolic acid cleanser, you probably are going to be fine using it to your underarms and body folds on a daily basis in the shower. And then next are the lotions. Again, it depends on the concentration, but as I mentioned, the retinol body lotions are pretty gentle, so you can definitely use it for the most part in your everywhere, including your body fold areas. Again, always test if you're super sensitive skin. M-lactin is one, like I said, I love for keratosis pilaris, and I definitely recommend those to my patients who struggle with dark underarms and neck from acanthosis nigricans. So M-lactin can be used in the underarms, neck, and groin folds, but again, it can burn, and so this is where you probably, because of the location, only limit the use to once or twice a week and then gradually increase as tolerated. I would say of all the products I mentioned, probably that necessary body peel, because of the higher concentration of actives, this is where I would say unless you can tolerate using it on your legs, for the body folds, I probably would not use it more than a couple times a month. And the first time you're using it, you have to be really careful. You probably don't want to be using that body peel immediately after you've shaved in your underarms, because shaving itself is a physical exfoliant. It can cause trauma and all of that. So it's just, you have to just be very careful. The higher the concentration, the more potential the irritation, and that could add more inflammation that can worsen hyperpigmentation. Okay, now let's talk about prevention. Well, again, it depends on the underlying cause, but if it's acne, seeing a dermatologist, treating your acne, your body acne, so benzoyl peroxide wash, getting on a salicylic acid cream or spray, and then treating your body acne with adapalene, and even prescriptions are going to be really helpful. If it's from dark underarm, inner thighs because of acanthosis nigricans, certainly M-lactin can be really helpful, but here it's probably going to be more important to see a dermatologist, to see even your primary care provider, because often there is an association with prediabetes, diabetes, PCOS, and metabolic syndrome that also needs to be addressed. Otherwise, the acanthosis nigricans will just worsen, and the thicker they are, the darker they are, the harder they are to treat. So prevention is just as important, if not important, than treatment. Now, a lot of times people may just get dark underarms from, say, irritation from a deodorant. And so this is where using probably fragrance-free products, going with an antiperspirant and not a natural deodorant that often can be a source of contact dermatitis that may actually cause dermatitis, and thereby post-inflammatory hyperpigmentation. That's actually a very common cause I see. And if you don't like antiperspirants, using a benzoyl peroxide cleanser a few times a week into your underarms can help control odor. And then shaving, as I mentioned, shaving, that frictional component, skin-on-skin rubbing, tight clothing can often be a source of over time, kind of that slow brewing inflammation. So this is where, avoiding tight clothing that may be rubbing on your skin. If you are prone to chafing, even like a barrier cream, like petrolatum, like diaper paste, or even like advanced cyclophate, where there is a cream that protects your skin and minimizes that skin on skin rubbing, can be helpful. And if you want to continue to shave, then shaving with a fresh razor and using a shaving cream and going with the direction of the hair growth is going to be really, really important. And that also is important too if you struggle with strawberry legs, and shaving can also induce some worsening of that as well. And so these are some of the common causes and ways you can easily modify your personal care routine so that way the hyperpigmentation doesn't get worse. And then obviously the one thing that we talk about all the time is sun protection. And especially in the summer, if you are, wearing tank tops, shorts, dresses, and you have hyperpigmentation of your back, your chest, your lower legs, either wearing long sun protective clothing or using sunscreen regularly, especially if the hyperpigmentation is still present, getting more UV exposure is going to contribute to the hyperpigmentation, but definitely make it harder for them to fade. So this is where picking a sunscreen that you like to wear, that is not going to be heavy, that is great for summer, is going to be more ideal, or just go with some protective clothing. But if you are looking for sunscreen, one of my personal favorites, and Helios from La Roche-Posay, their Melted Milk SPF 60. This is a great, lovely, lightweight moisturizer. Literally, this is my probably go-to. It's also water resistant for up to 80 minutes. I love this for myself, for my face and body in the summertime. It's so lightweight that after you put it on, you really don't feel like you put anything on. So I really don't like that sticky feeling in the summertime when it's hot and humid. So this sunscreen not only will give you great protection, but it feels like you're really not wearing much at all. So definitely love this one. And there are lots of other great ones too, like Neutrogena Hydro Boost Body Moisturizer is also a great one. So lots of great options, but just make sure that you are cognizant of the amount of UV exposure your area of your body is getting, that can make the hyperpigmentation more difficult to fade. And lastly, if you're struggling or just not getting better, see a dermatologist. There are a handful of great cosmetic in-office procedures that can be helpful, all the way from chemical peels like TCA peels that can be used to improve acanthosis nigricans, to AHA professional strength peels that can help with body hyperpigmentation. Salicylic acid professional strength peels are great for acne as well as post-acne marks, as well as sometimes even microneedling, different types of resurfacing laser, as well as pico laser that can be actually used on darker skin tone and safe to use. Even laser hair removal can be helpful with hyperpigmentation, at least preventing that from occurring down the road too, especially if the hyperpigmentation is from repeated friction due to shaving, right? So there are a lot of great options. Just speak with your dermatologist, and not to mention the prescription strength creams that you can use, including tretinoin, higher strength azelaic acid, and even hydroquinone could potentially be an option. So just talk to your dermatologist if you are really struggling. There are a lot of great options available, and also just to make sure that you are actually treating the appropriate condition. And so getting the appropriate diagnosis and getting on a good management plan is really, at the end of the day, the most important thing you can do. All right, guys, that's all I have for you. Let me know, do you struggle with body hyperpigmentation? Let me know what products has worked well for you in the past. And as always, please let me know if you have any questions. Always welcome comments as well as future topic ideas for this channel. Thank you so much for watching, and I will see you next time.